Good morning, everybody. My name is Donna Stachowicz, and I'm going to talk to you all about carrying your healthcare career OCONUS. I'm going to try to make it more applicable to the rest of the audience, though. So I'd like to start just being a little bit more interactive. Could I have a raise of hands in here if you are a healthcare worker? So raise your hand if you're a healthcare worker. Great. Now keep it up if you're a nurse. RN, LPN, LVN, that's a lot. So you can put your hands down now. Nurses actually happen to make up the largest portion of the healthcare workforce, and so that's why I'm going to be emphasizing that today. Now raise your hand if you know someone who works in healthcare. Almost all of us, right? It's a big amount of our workforce, healthcare workers. So there are unique needs of healthcare workers, including licensing and professional hours so that we can keep up our skills, and it can be really difficult when you move overseas. So I'm going to go back a little bit and tell you a little bit about me and why I feel like I'm a little bit of a subject matter expert in this field. I've graduated from nursing school from UPenn back in 2001. I was an ROTC student, and I immediately earned a commission. I was an active duty nurse for 6 years, but I've been a spouse far longer. I got out of the Navy in 2007, so I've been a spouse, we can do the numbers, a lot longer. One of the times during my spouse career, we moved to Rota, Spain. I had an excellent resume at that point. It was the peak of my game. I had certification in emergency nursing. I had just earned my master's and became a nurse practitioner, and there was no opportunities in Spain. So I thought I didn't have as good of an outlook as I do now. And then when I came back to the States, I really I had a rude awakening. I thought that my awesome resume from before would be enough, and I thought that I could just get out there and be my bubbly self and it would be no problem. I had 4 months before I found a job, which is in the nursing field was almost unheard of. Usually you get hired right away. So I knew that when I came to Japan this time around, after I finally did get work in the States and now I came here, I knew that I had to change my game plan. And the common thread I see in all of our panelists, which are phenomenal by the way, I'm blown away, is that you need to think outside of the box. And that applies to nurses, teachers, lawyers, everyone that comes here to the base. It's very rare that you're going to step into a job that meets your exact skills, your exact experience, your educational level. So some of the ways that healthcare workers need to think outside of the box is thinking about the things that are not necessarily clinical, because we all want to get our hands on our patients. We all want to keep up those clinical skills, but sometimes the MTF, medical treatment facility, military treatment facility, doesn't have enough jobs, so you need to think about healthcare administration or nursing and administration. Informatics is a huge and burgeoning field in the medical community, so medical informatics, there's specific nursing informatic degrees, and there's medical informatics, also nursing or healthcare research, school nursing, public health, and finally nursing or healthcare education. So that's one of the ways, is going back to school in those different fields, since you can't get one-on-one clinical time with patients, are a good way to keep up your career and not have a gap. Another thing is thinking about what your passions are and trying to bring your healthcare experience into that. For example, I like fitness. I just love weightlifting. I love going to the gym. And when I got here and there were no jobs for a nurse practitioner, I started going to the gym. I started talking to other people. I met someone who was a fitness instructor, and they were a nurse. So I was like, oh, I could do that maybe. And so you know how easy it was to take a certified personal trainer test with all the anatomy and physiology background. That can apply to anyone in healthcare. It's not just nurses that take those classes. So if you want to think about fitness, the Navy brings in those speakers all the time to Purdy Gym and to Fleet Rec that can give certification courses. So think about becoming a certified personal trainer or a certified nutrition. You don't have to do the RD necessarily. There's like smaller certifications. But if nutrition is your passion, if fitness is your passion, marry those two. Play upon your experience, just as Jill talked and Marie and Josh and all of us have said. Build upon what your strengths are. You definitely want to get out there and network. And again, more thinking outside of the box. When I came here, first had my blinders on, MTF. I've got to get into that hospital. And it's like an iron, clad fortress, it seems, to get in there. If anyone has tried to volunteer there, they know what I'm talking about. But thinking outside the box, school nursing I mentioned. And not just nursing, they have EDIS. Everyone has heard of EDIS for Educational Delayed Intervention Specialist Development, sorry. And they need physical therapists, they need speech therapists, occupational therapists, so it's not just the hospital. There's positions for healthcare in the WIC office on base. Navy Marine Corps Relief Society has a visiting home nurse. And definitely in the schools too, we need substitute nurses and with the EDIS people. Finally, just like some of our other panelists are doing, we have telecommuting opportunities for healthcare workers. All of us know medical terminology and could easily walk into a coding job or an insurance job, counseling people, triage over the phone, electronic ICU work. That is becoming really big, where nurses and other licensed people actually monitor patients electronically. You could actually really keep up your skills that way. Finally, volunteerism. I'm just so happy that Jill spoke to that. I actually, my biggest time commitment right now is with the Red Cross here on base. I spend between 10 to 20 hours every week volunteering. It's also a part of my degree program. But Red Cross is 90% run by volunteers, and you can come and make whatever you want to do and start a program. And it doesn't have to be with Red Cross either. I know a phenomenal nurse practitioner here who started a lactation support group on base because that was her passion, that was her call, and it's going great. I have a friend here who is a neuroscience nurse, and she started doing Reconnection Workshops, which is a program that we offer to help people in transition for deployments, helps families talk about communication strategies before things become a problem. Nurses that have started an entire professional network here on base and are running a health fair coming up in April 19th. Hope you all come to that. There's my plug. So there's just many, many opportunities, but you really have to be willing to think outside the box. And you might even have to, reinvent yourself. We're constantly reinventing ourselves as military spouses. I think that's like our motto. Be semper gumby, always flexible, reinvent yourself. Volunteer, get yourself out there. And if you are into furthering your career and getting advanced degrees, even if you can't do the clinical portion, like if you want to be you want to become a nurse, or you want to become a nurse practitioner, or you want to become a physical therapist, you can at least get your prereqs done. A lot of places will accept your transcripts, your prereqs, your credits from a reliable school. So don't be afraid to do a little bit of online schooling. It's a little difficult with the time change, but it's doable. And I guess that's it for me. I just excited to be here and excited that I opened my mind to different opportunities, and I look forward to talking to you guys in the breakout session.